I'm Patty Enrado with HIMSS TV, and today I'm with Pritesh Parekh, Chief Trust and Security Officer at Virtustream. And today we're going to talk about cybersecurity. Welcome, Pritesh.
Thanks, Patty, for having me.
Great. So let's start with the big picture of securing information technology in the healthcare sector. So as an industry, healthcare requires more protections and compliance than most other industries. So as the Chief Security and Trust Officer for a leading private hosted cloud provider, can you give us a sense of the types of risks and dangers that healthcare providers and payers are dealing with on a daily basis?
Yeah, great question, Patty. So as per the Dell Technologies Digital Transformation Index, digital transformation has significantly accelerated. And what that means at large, including healthcare, is to adapt to the new rules of winning, agility and resilience. If you pause and think about the shift, macro conditions are driving new kinds of risk that require expanded risk management and a comprehensive response plan. Of course, there is a spike in ransomware, about which FBI recently issued a warning for healthcare providers, and the ever-persistent challenge of keeping up with the compliance requirements. At the end of the day, the purpose of healthcare organization is to provide uninterrupted, high-quality patient care, so data breach and disruption of critical care services are always going to be the top concerns for the healthcare organization.
Okay. So for most of 2020 now, as you know, the global pandemic has significantly impacted, every business and agency across the United States, and particularly the healthcare industry. So from a cloud security and compliance perspective, how did the urgency of this crisis affect the technology needs or concerns for IT leaders?
Yeah, Patty, the global pandemic situation is grim, with over 56 million cases worldwide, nearly 12 million in US alone. It is also one of those times where we see rapid innovation that is driven by true humane cause, saving lives rather than just pure commercial success. For healthcare organizations, new use cases such as telehealth have shifted higher in priority. So healthcare organizations need to retool how doctor and healthcare workers interact with patients. And to support those new use cases, organizations have accelerated digital-first and cloud-first strategy. And with this change, sophistication of cyber attacks have also grown, pushing the need for shift to a more proactive security posture and to bring consistency in defense as well as security at scale best practices.
Okay. So security breaches are making the headlines on a regular basis, and some have written that 2020, it was the year of ransomware. You're speaking with IT leaders and chief security officers every day. So clearly these major cyber attacks are of, great concern to them. But what are your other concerns that you're hearing about from your customers, these days that don't make the headlines? What's keeping them up at night, and, what's keeping you up at night?
Interestingly, yesterday, Virtustream's senior executive team spent the day with more than 20 of our top enterprise customers. And one of the top discussion topics was security. Security and compliance risk are significant considerations as healthcare organizations move large pools of confidential data to the cloud. At large, cybersecurity leaders believe that despite significant advancement and thousands of cybersecurity tools available today, cyber attacks continue to make headlines. Healthcare organizations manage a plethora of tools and technology to stay secure and maintain their security posture. The complexity of managing these tools across multiple cloud platforms and the skill sets required can be quite challenging. And what we are hearing is this fragmented, complex cybersecurity ecosystem leads to building and managing different security programs in the data center versus the cloud. And that makes it nearly impossible for organization to get a holistic security posture across all their digital assets. And therefore, there's this very, very strong need and urgency to unify their security processes and controls across all their environments.
So what's tougher these days, driving game-changing innovations, like your recently announced trust platform, or changing people's behaviors?
Definitely changing people's behavior. One well-known part of changing behavior is to follow security practices. And that is a cultural change. It comes with continuous education and security awareness. And another often overlooked part is changing cybersecurity teams' behavior, a mind shift from reactive to proactive approach to security. And this kind of shift needs state-of-the-art tools, such as Virtustream's Trust platform. When we designed the platform, one of our goals was to do in such a way that the platform prompts proactive actions. Behind the scenes, we implemented an aggregate, consolidate, and simplify approach to security data, and then presented in an intuitive, minimalistic user interface. The focus is on taking proactive actions and bringing the mindset change by elevating security posture from reactive to proactive.
Okay, great. So with Virtustream's recent announcement of its new Extreme Care services for security and compliance, why should a customer in the healthcare sector pay attention?
Yeah, that's another great question, Patty. Having worked with several healthcare clients, we observed and engaged in several conversations to understand the real challenges they face. And that has influenced our extreme care services for security and compliance. For example, in addition to security monitoring and management, we included on-demand consulting in our offer because healthcare organizations are struggling with cybersecurity staff shortages. The on-demand consulting feature eliminates the traditional barrier and extended cycle times in acquiring certified expertise. And as you know, time is of essence when it comes to cybersecurity. Then we have the Trust platform, a security platform for multi-cloud workloads where customers will get near real-time visibility into a unified, holistic security posture that prompts proactive action to detect and prevent threats like ransomware before they become a breach.
Okay, great. So for an IT leader evaluating on-premise versus cloud-based environments, for a major healthcare system, are there specific advantages in one environment over the other when it comes to matters of security, privacy, and compliance?
Cloud providers have invested heavily in building a world-class security and compliance program. Microsoft, as an example, spends $1 billion a year on the security of its product. Not even the largest enterprises are able to match this level of cybersecurity investment. Not only can it be more secure, elastic, and scalable approach to managing workloads, but it's also integral to IT modernization goals. However, most cloud providers have a shared responsibility model. A shared responsibility model depends on the type of cloud services that is being offered. So for IaaS, PaaS, or SaaS, the shared responsibility model can be different. And in most cases, it is different. Right? Typically, higher up you go on the stack, the more the cloud service provider is responsible for. And a simple example with hyperscalers, right? Security of the cloud is hyperscalers' responsibility, and security in the cloud is customers' responsibility. And what really happens is that several organizations sometimes incorrectly assume that their cloud providers are taking care of security controls like patching virtual machines or managing logs. And because of these misunderstandings, there are gaps in security coverage, leaving the organization exposed to cyber attacks. So it's really important for customers to understand their cloud providers' shared responsibility model and what they are responsible for so that they can protect their business.
Okay. So Virtustream touts itself as an expert cloud provider for mission critical applications, but when you look at an industry like healthcare, with patient data and electronic medical records and so forth, many would argue that nearly every workload is mission critical. So how does Virtustream's approach from a security and compliance perspective set it apart from other technology vendors?
You are right. We can interpret mission critical in many ways. When it comes to healthcare, we believe patient care is why healthcare organizations exist. Systems that assist doctors and caregivers in making timely and accurate decisions are the mission-critical systems in healthcare. Now, as specialists in cloud hosting and managing mission-critical systems, we take a broader view of security and compliance. Resiliency, availability, performance, and uninterrupted access matter the most, especially at critical times. So we have purpose-built our cloud platform to deliver these attributes. Then we have an embedded model where we embed the 4 pillars of trust: security, compliance, privacy, and transparency. And we do that in everything we offer to our customers, every process. So it's a very holistic approach for building a trusted partnership with our customers. Now, simplicity and proactive actions are essential, especially when dealing with extremely large and complicated applications such as EHR systems. So we have designed state-of-the-art trust platform and extreme care services for security and compliance to bring that simplicity and proactive action. And we have also accounted for future needs. For example, we understand that it's a multi-cloud world. So we have designed the platform for extensibility across multiple cloud platforms from the get-go. The platform can easily connect with popular hyperscalers, extending unified and consistent security from multiple clouds.
Great. And thank you so much for your time, Pritesh.
Thank you, Patty. Appreciate it.